Just before I had the stroke, I didn't feel well. I had bouts of vertigo. If I bent down, I would go really dizzy and feel really sick. And that happened for about 2 weeks. And then the week before I officially had the stroke, I was taken into hospital with a suspected stroke. I saw Mr. Abdul Hamid and he said I hadn't had a stroke. And I was very emotional because I think it was more fear than anything of what had happened. But he said, you should be happy because you haven't had a stroke. And so, of course, I went home, but I did have weakness in my left arm. I remember trying to get dressed and couldn't pull my trousers up because I couldn't grip with this hand. And I came home, and for the rest of that week, my niece had travelled up and she was helping me with the shop that I was opening. We were getting stock there and we were putting things up and it was starting to really take shape. And it was the Saturday morning. My granddaughter had stayed overnight, and when she stays overnight she sleeps with me. And I got up. Well, went to get up out of bed and I just fell on the floor. Tried to get up and fell down again. And I just said to Amy, go and get your granddad. In which she did, and Jim came in and helped me get up. And we both sort of looked at each other and realised that this time I had had a stroke. I could tell my voice was slurred and I felt my face had gone at one side. This arm was totally nothing. I could lift it up, but it would just drop. Fortunately, my leg wasn't affected. And why, I don't know. Of course, I was whisked off to Hull Royal. CT scan, MRI scan, and then admitted to ward 110. And saw Mr. Abdul Hamid and he said, this time you have had a stroke. Well, that is something I just didn't want to hear and I didn't want to believe. And that was the hardest thing at any point, was accepting the fact that I'd had a stroke. The word stroke brought fear to me because my father had had a stroke at the same age that I was. And I just thought, this is it, I'm on my way out. So you'll have to excuse me if I get a little bit emotional now. Apparently the type of stroke I had was a right middle cerebral infarction. I think that's how it's written down, which means I had a blood clot in one of the arteries at this side of my head.
That's right.
Which affected the left side of my body.
Yeah.
Another thing to contribute to the fact that I didn't want to believe what had happened to me was everybody that came to see me was saying, you look great, you don't look as though you've had a stroke, you know. And my brother came up from Nottingham and he just said, well, you look wonderful. I was expecting far worse. And that sort of gave me a little bit of, well, have I really had a stroke? You know, are they winding me up? But why would anybody wind me up about something like that? No, they wouldn't. And I could tell that my speech was very slurred still. But the support in the hospital was fantastic, and everything that was offered to me, I took it and did it because I wanted to go home normal. I wanted to go back to how I was. I now know that was an impossible dream, but at the time it was in my head. I'm okay, I'm going to get through this. So I get up in the morning and go off to the upper body therapy and do them awful bottle tops. That was the nightmare. I could do everything else but those bloody bottle tops. The pegs were okay, I could handle the pegs, but of course sometimes they'd fly out my hand and I'd get frustrated. And then the speech therapist came to see me. Now that was fun. I read a passage to her and she said I read really expressively and she enjoyed hearing me read. And I said, well, I read regular to my granddaughter. And of course we got into conversation. What's the favourite story? I said, it's the Gruffalo. So and she didn't know the Gruffalo, so Amy brought in some of her books that we read regular. And I had little story times on the ward. And I would read all the kids' stories to whoever cared to listen. But one thing I learned from that was to really pronounce every word as clearly as I could and to shape my mouth around the words, which I did. And I feel to this day that has helped me get my speech back to a reasonable level, and I feel very comfortable with my speech now, apart from when I'm tired and then I do start to slip a bit. But progress was slow. It wasn't quick enough for me because I like things done yesterday. So everything was too slow and I want to go home. That was all I could say. Is everybody that came to see me, I want to go home, please let me go home. You can't go home yet, you're not ready to go home. Oh.
And I think you met me then, didn't you?
Yeah, and then Jeanette came and, you can't go home yet, you can't do this, you can't do that. And I was like, oh, go, I don't want you. I want somebody who's going to say, yes, you can go home. Although it was a bit of a nightmare journey, there were nice things along the way as well. Lots of nice caring people. And it certainly brought home to me who my closest friends were and who my strongest family members were. And I don't know, it was just trying to understand what had happened. Because inside you feel the same. But outside it's not. So
I think you had a bit of a light bulb moment at East Riding Hospital.
I did.
You'd had a good think about what had really happened.
Yes.
And you had a bit of a dip.
Yeah.
And you were quite angry with Jim because he'd given you shop up, or he wanted to.
Yeah, that was something I was looking forward to, was resuming opening my shop. It was a needlework shop and it'd been my dream for a long, long time, and I'd finally about realised it. And we had the case conference, hadn't we?
That's right.
We'd had the case conference, and at some point in that meeting I'd said, you know, I'm just looking forward to going and maybe just sitting in the shop and seeing everything laid out. And that's when Jim dropped the bombshell. They'd closed and emptied the shop. At the time, it was like everything had been taken away from me. But when I sat down and thought about it, they'd done the right thing, because they couldn't pay rent on a shop that wasn't taking any income. The stock was sat there vulnerable from theft or just getting damp and just wasting. And they had all got together, my niece, my 2 daughters and my husband, what we're going to do. And they took a joint decision. And although I felt very betrayed, when I sat down and really thought about it, they had done the right thing. The stock was all there. I could start again another time if I wanted to. But to be honest, now, 2 years on, I don't want to. I think physically I could now. But emotionally, I am a different person. I don't think I have as much strength as I used to have.
What's the tiredness like?
The tiredness is awful. It's overwhelming. I can get up in the morning and get myself washed and dressed, and then I have to sit down or even lay down just to get over the exhaustion of doing that. But there again, that's another stage in moving on. When I came home, Jim had to help me wash, he had to help me dress. I couldn't do much on my own. Now I can shower, I can bath. And when I had a bath at first, I had a seat that lowered me into the bath. Now I can get in and out of the bath on my own. So they're all stages, they're all little positive moments for me.
The one that impressed me the most was when I came down and you were threading a needle.
Oh yeah.
That was a real impressive thing for me.
Right.
Because when I think what restricted movement in that hand.
I don't remember how restricted I was.
Very restricted.
Yeah.
Yeah, very coordinated.
I do know I have a weakness there still. And some days I get up and it feels very weak. Other days I get up and I don't even think about it. But yes, I can knit again. I can crochet. I can use my sewing machine. They're all stages that I've made myself get to. I've actually done some picture framing, which I didn't think I was ever going to do again. And take offers of help and support.
Yes.
If anybody says to you, can I do anything for you? Think of something for them to do. Because they want to help, they want to be part of your progress. And I had a neighbour, and selfishly she's moved now, but she used to come and take all my ironing, do my ironing and bring it back all hung up and all nice and neat, and then she moved. So I had to iron. So I had to get on and do it.
That's good therapy.
That's
good therapy.
Yeah, but I soon fell out with that one and gave up. And who wants to iron anyway?
Life's too short.
Yeah. Yeah. And Jeanette kept coming to see me. Great support. And why don't you go out for a meal together? Go and do something together. Well, that has started something, because now every Sunday I look forward to going out for my tea. And, one other thing, when I came home, I spoiled myself. I had my nails done. I had some body massage and, just things for me. And I treated myself to some new clothes, a style that I've never worn before, but I found a style that was nice, and I ditched all my old makeup and I bought new makeup, and I put my face on, and I wear nice clothes, and that really boosts my days when I get up and, make myself up and look nice. But there are days when I don't want to do that, so I don't do that. But certainly giving time to yourself is important. The hardest thing in the whole journey was accepting the fact that I have had a stroke, and it has changed my life. But I have my life to make the most of, and to have new interests or retake the interests I had. But I get very depressed still, very down. And sometimes I just don't know how to pull myself out of that. But I get there. And having a very caring family and support around me is a big help. And if they offer to do something, like I say, let them. Let them do it. Sit back. All I have to say to Jim now is, oh, I am tired. And I say, well, go and have a lie down. Now that would have been something I couldn't ever have dreamt of previously, because I never stopped. I worked and worked and worked. And sitting down, laying down was a luxury. I would always find something to do.
Do you feel like you've accepted what's happened now?
No. No, I still have days when I don't want to believe I've had a stroke. Why me? What did I do so wrong to deserve this? Because I was just on the up with everything in my life, and it was like, bang, stopped. So, no, I don't think I have fully accepted it. There is a level of acceptance. I do know my limits. I know there's certain things I can't do with my left hand. And won't attempt because for fear of dropping something and breaking it or making a fool of myself. But I do force myself to use it. I can pick things up, and I make myself pick small things up so that I'm using all the finer motor movements. And that was another blow. I mean, I had so many losses that year. Jim came to pick me up from the hospital, and he looked very upset. And I said, what's wrong? And he said, I've just had to bury the cat. And our cat that we'd had for 22 years had died the day before I came home. And that was hard. So I had to come to terms with a lot of loss. The loss of me, as I was. The loss of a cat that had been with us for 22 years. Loss of my shop. Loss of my ability to work. And then, to top it all, my brother died. And that's still hard. It's very hard. Because I wasn't well enough to get to his funeral. But he won't mind. I'm just laughing at my cat.
So many cats have you got now?
I've got 3 cats. When I came home we had one, Delilah, my big black and white girl. And Jim, I said I wanted another kitten because we'd lost Rookie. And Jim agreed, and we decided we wanted a male tabby. And we rang round all the different places, and we found one at the Cat Protection League. And the lady was wonderful. We went to view him, and we saw him and said we'd like him. And the lady from Caps Protection brought him. She actually came all this way out from Dunswell to bring him.
Right.
And that was lovely. And it gave me something to do, cleaning out the litter tray and feeding him. And then this little lady turned up. She was living in a home with 2 children who were a little bit rough with her. And they were looking for somewhere else for her, so I said, I'll have her.
So this one's...
And she's my little poppet. This is Dolly.
Dolly.
Yeah.
Mm-hmm.
Yep, she comes to bed with me on a night, lays at my side.
Yeah, no. I had to make some decisions that had to be done. Think positive. Yeah, I think. Yeah.
At the time, I was really angry with Jim.
But I could see that normally, if you wouldn't have had the stroke, you wouldn't have been, because you would have seen the reason.
Yeah.
You couldn't reason with anything.
No.
Really.
I had blinkers. I didn't want to see beyond what I was.
Normal.
I mean, there has been some advantages for myself. I've learned what all the buttons are on the washing machine. And also I can turn white things into green things.
Oh, yes. Yeah. Yeah, when I was in hospital, all my underwear was grey.
Not 50 Shades, I'll tell you.
And then, when I've just been into hospital again for some surgery, and everything's green.
Is it a nice shade of green?
It's not a bad shade of green. Yeah.
Camo, isn't it?
Could have been better.
No,
It could have been white like they were.
Yeah. In some ways, for me, I'm lucky that in one respect, that I haven't had to go out to work and look after her at the same time. You know, because I'd retired anyway, so...
Yeah.
And it made me feel a bit more... It kicked my backside into gear a lot of it, because, you know, with my minor health problems, I got...
No, but you'd had a minor stroke previously.
Yeah, and other things. And but I thought, how can I put it? Your frustration at not realising how you are progressing very slowly, getting better, and coming to terms with it taking so long. You know what I mean? I can see changes that for the better, you know, monthly. It isn't going to happen overnight. You know, I think you've resigned yourself to the fact that you will never be 100% like you was.
Do you remember me seeing you in hospital and breaking? I made you cry constantly. And one of the things I said to you that it's probably going to take a good couple of years.
Yeah.
And you really didn't.
I didn't want to hear that. No.
So,
and here I am 2 years down the line.
And
it's taken a couple of years. Yeah.
But steady progress, and that's the name of the game, really.
It is. And something else when you came here to see me was make a note of things that you've done.
Yeah.
And I didn't always do that, but mentally I did. You know, and I'd come through to Jim and say, another milestone, I've done so and so.
Yeah.
You know.
Just boost your confidence.
Yeah.
Yeah. You easily forget what you were doing to how far you've come along. But
I remember something I couldn't do in hospital was flick through a magazine. I couldn't hold it. But now I can pick my magazine up and I can flick through the pages. I could not do that. It was on the floor or wherever.
Yeah, but you've got a more positive attitude now. Before it was, I can't do it, so you'd sling it and give up. Wouldn't try. Now you think, I'm going to do it. You know.
That's true. It was a lot to do with that.
Yeah.
So
Yeah.
do you think, as a couple now, you're getting back to some normality as a couple?
Yeah, she beats me up every morning.
There you go, you see.
Whoops.
We'll cover the bruises well.
Yeah.
Oh.
Yeah, we go out once a week.
I drink, Jim drives. It used to be the other way.
Perfect combination.
Yeah.
Where's your favourite place to go?
Kilnsea,
All right.
down to the Crown and Anchor.
Oh yeah.
The
That's
food
just
is
on the bend,
fabulous.
isn't it?
Yeah,
Yeah.
the food is absolutely fabulous.
Yeah.
Plus, it saves me cooking, and I'm into wash up once a week.
There you go.
There you
Method
go.
in your madness. There you see.
Exactly.
And we occasionally go over to the Spotted Duck
Yeah.
tea rooms at Fittling.
And the Roose Arms on a Tuesday.
Steak
tea.
night, yeah.
Yeah.
So, yeah.
Yeah.
Which you
Brilliant.
wouldn't have even. No, you used to flatly refuse going out, didn't you?
Yeah.
No, I don't want people to see me like this.
Yeah.
I'm useless, and there you go. And you're not now.
When I think back, when I came home, I had so many different aids, which were brilliant and did help me. But accepting that at 57,
Yeah.
you know, I've got to use a bent fork like a baby.
Yeah.
I've got to have a thing with wheels on to walk. That was hard. Even a guard around my plate to stop my food shooting off.
I think I'm fairly lucky that I've always been sort of fairly patient. Anybody that
Yeah.
not
Oh! No, I know somebody who can lose his temper very
but
quickly.
not very often.
No, but when you do,
Oh yeah,
yeah.
well, there you go.
Yeah, we're getting back to normal bickering, innit?
Right.
Well, there you go. Hmm.
No, to be honest, I don't know what I would have done if I didn't have Jim. I've never felt suicidal. I think I was telling you this last week. I haven't ever felt suicidal, but I have felt feelings of, what's the point? You know, why am I here like this? And it's all to do with the depression and,
It's all to do with loss,
yeah,
isn't it? Because that purpose that you had
yeah,
is a different purpose now.
yeah,
So your different purpose now is to be getting made up and
yeah.
going out and enjoying yourself now.
Looking at art.
Yeah, you don't have to run a business to keep
No.
the house going. You know that's a thing. You've done it. You've been there. There's no point in dwelling on it. Move on. It's baggage you don't.
The
need.
sewing workshop is now going to be my sewing room. The framing workshop, sorry.
Excellent.
We're changing it into my sewing room.
Right.
Yeah.
That'd be good.
And the person I was speaking to this morning on the telephone is a friend of mine, and she's been helping me sort all the stock from the shop
Right.
because I'm gradually getting rid of that.
Yeah.
So,
Have to have a sewing circle.
yeah, you can sew buttons on, can't you
I
now?
was sewing buttons on my shirts last night. wasn't I?
Yeah,
Yeah.
but you should use the same colour cotton as the shirts.
Listen,
Not black.
I was wearing it at the time, so I couldn't see it, and I was sewing it to my best.
Right.